Hi everyone, my name's Lola. I'm a GP registrar, so that's just before being a fully qualified GP, working in Lewisham. And I was actually working in A&E for a year last year up until August, so I was there in the first wave of the pandemic. And then last week, having received quite a few messages from friends who work in A&E, both doctors and nursing staff, I sort of volunteered to come and help because there's so many staff shortages. At the moment, people are sick, having to isolate just because of the spread of coronavirus, that the staff who were remaining were just overwhelmed. And I think what struck me on Tuesday, which is when I went and did an evening shift after work from the GP surgery, was just the sheer amount of sick people in the hospital. And I think, as Sonia was saying, you know, having two people to a cubicle, not having space to see people in the resuscitation area, and also the ambulance crews not being able to unload people on that Tuesday because it was just so busy and there wasn't any space, and the intensive care beds being full. So doctors having to make quite difficult decisions about resources like CPAP and intensive care beds, which they probably wouldn't make before. And so I've got a dual perspective because I work in primary care in a day job. So I'm the doctor talking to people on the phone, assessing people over the phone, or doing a home visit and deciding whether they need to go to hospital. So when I call LAS and they say it's a long wait for someone to get to the hospital, that puts quite a burden on us as healthcare professionals, especially with breathing problems. I can't really describe how it feels to listen to someone having difficulty breathing over the phone, and to say to them that the ambulance is coming, but I can't tell you when, which is what I did today because it's very hard. And also in primary care, we're seeing the mental health burden of coronavirus hugely. Lots of anxiety and depression amongst our patients, especially because they're isolated, and in general, any pandemic is going to raise your anxiety. And just, sorry, I'm getting a little bit upset. And that's just very hard. And so you can understand why after sort of 10 months of this, why staff are having quite a low morale, why there's burnout amongst staff. And it's hard, especially when, you know, a lot of, I have the privilege of being able to go to A&E and pick my shifts when I need help. I'm not working there full time, but I do know that my A&E colleagues, my medical colleagues, the nurses, they've had their leave cancelled for January and February. I was speaking to a nurse on Saturday when I was in A&E, and she was just saying, you know, I haven't had a break for months and my leave at the end of January has been cancelled because they have no one, you know, that they're staffing zones which normally have 5-6 nurses with 2 nurses just because of the staff shortages. And I think I would reiterate what all the other doctors and everyone's been saying today, is that this is definitely something that has been mismanaged completely by the government. And we always know that there's going to be winter pressures, and actually we could have prepared better for that as well in the summer and leading up. I'm going to leave it there, actually.